Hi, my name is Jen. I'm a registered nurse and a student nurse practitioner at Auburn University, and I'm here for my head to toe assessment on my patient Jonathan. Here's my 360 view of our room, our ceilings. My table consists of all the things I need, and my ears are empty. All right, so for purposes of this exam, I'm only going to be assessing Jonathan's one side for time constraints. Before he had walked in, I actually washed my hands. I took all of his vitals, his height, his weight, which were all within normal ranges. When he had first walked in, I looked at the way that he was walking, the way that he was dressed, his gait, if there's any sort of disturbances with his grooming, and if he was well nourished, which he is. Everything looks great. So I told him that I'm going to explain exactly what I'm going to be doing. I'm going to be assessing his skin at all times to make sure there's no lesions to be noted, any sort of redness or signs of dehydration or edema. To start out, after washing my hands, I'm going to check his head. I'm going to inspect his hair and if there's any sort of masses or tenderness or any infestation of any kind of bugs. So I'm going to just look at his hair. It is well distributed. It's nice and brown. The texture is thick. He doesn't seem to have any sort of baldness in any areas. I don't see any lesions or edema. Is there any sort of tenderness?
Nope.
Okay. As far as just his face, I'm looking to make sure that everything looks very symmetrical. I don't see any apoptosis. As far as cranial nerve 7, I want him to smile, frown, puff your cheeks out. Perfect. I'm also going to just take a look at his eyes, make sure that his pupils look like they are nice and symmetrical. They look like they're about 3 millimeters each, which is very normal, and both are around the exact same size. I'm going to have you puff out your cheeks really quick too for that cranial nerve 7. Perfect. I'm going to take a look at his sclera, which is and his iris, his brown eyes, his pupils, his conjunctiva. Doesn't look to be any sort of drainage, and palpate the inner ducts for any sort of abnormal drainage, and everything looks great. I'm going to get my Snellen. This is for cranial nerve 2. I'm going to have him read the 20/20 vision area. I'd be standing 20 feet away for it to be 20/20, but for this purpose of this test, I'm going to be up closer for him. So with one eye covered, can you please read this line?
LTFPH.
Cover your other eye. Can you do it one more time?
LTFPH.
And with both eyes uncovered, can you read it again?
LTFPH.
Perfect. So that one was for cranial nerve 2. I'm also going to do a cover test for his peripheral vision. If you can take your hand and cover your right eye, and I'm going to cover mine as well. And if you could tell me when you see my fingers.
See him. See him. See him.
Same side. Cover your other eye.
I see him. See him. Got it.
Okay, perfect. I'm going to take a look inside of his eyes to make sure that his optic nerve looks appropriate, that there is no sort of abnormalities as far as a retinal detachment, the red light reflex, and his fundus and macula. So I'm gonna dim the lights a little bit. And everything looks very normal. For the head portion, I'm going to take a look at his sinuses. I'm going to palpate his maxillary, his frontal. Look for any sort of tenderness. Do you feel any tenderness?
I don't.
Look at his any kind of cracking or his TMJ. Can you do you feel any tenderness? For cranial nerve 5, I'm going to see if there's any sort of issues with his ability to clench down. So if you could clench down with your teeth, perfect. Everything looks great. Next, what I'm going to do is just inspect his nose, make sure there's no visual abnormalities on it, make sure there's no sort of deviation or bruises or lesions. To check for patency, I'm going to have him take his hand on one side of his nose and breathe in and out. Other side. Perfect. So he can breathe out of them both equally. There's no foreign objects, but I'm going to take a look inside just to make sure. I'm going to get a new one. For the purpose of this test, I'm going to be using this one. If you could please put your forehead up. And I'm making sure there's no abnormal colored mucus or foreign objects. The vessels don't look inflamed, and any kind of deviated septum, and everything looks to be within normal limits. Staying on the nose, I'm going to do the cranial nerve number 1. So I'm going to have him close his eyes, and I'm going to be taking something and having him smell it just to see what his cranial nerve 1 is doing. What are you smelling?
Peppermint.
Okay, so that is good. That means his cranial nerve 1 is intact. As far as the going back to the eye, I'm going to be doing his cranial nerve 3, 4, and 6 with my pen light. So if you could just follow my pen light wherever it goes. And so for his vision test, I'm also going to be having this pen light go towards his nose, which is perfect. Both of his eyes go equally to the pen. And I'm going to do his reflex test and make sure that both of his pupils constrict. Too light, and that one's normal. And that one constricts. So that is within normal. That's a normal finding. The next thing I'm going to do is I'm going to be checking his mouth. I'm going to be looking for his mucous membranes and any sort of dental caries, as well as his tonsils. So I'm going to take my pen light again. I'm going to have you please open up your mouth. His tongue looks pink and moist. Pink and moist. His gums look nice pink and moist. No dental caries. I'm going to have you please stick your tongue out this is for cranial nerve 12. And go from right, left. Perfect. For cranial nerve 9 and 10, I'm going to have you open up your mouth and say ah.
Ah.
Even further.
Ah.
While looking at his tonsils, which are about +2 with no exudate. And for gag reflex for this purpose, I'm going to be using the edge of my reflex hammer. So if you can please open up your mouth. And gag reflex is intact. I'm also going to be looking at his ear. For this test, I'm going to be using the exact same one I used for his nose, and looking to see if there's a cone of light, make sure that there's nothing, foreign objects or any sort of wax buildup inside of his ears. I'm going to pull his ear back and up. And his tympanic membrane is intact. There's no bulges, no foreign objects, and touching his ear, making sure there's no sort of pain. His tragus, any pain?
Mm-mm.
All right, everything looks great. To test for his hearing, I'm going to be checking for the Weber and the Rhine test, as well as a whisper test. And this will test for his cranial nerve 8. So first I'm going to do a whisper test. So we'll just repeat after me.
1, 2, 3, 4.
Next I'm going to be doing the Weber test, and he's going to let me know if he's hearing the sound on one side more than the other, or no sound at all on one side. You hear it on
Both
both
sides.
sides? Okay. So that would be normal. For the rind test, I'm going to be testing the air versus bone conduction. So you're going to tell me when you stop hearing this.
Stop. Stop.
Perfect. So his cranial nerve 8 is intact with those exams. The next thing I'm going to do is, as well as looking at his skin throughout the entire exam, I'm going to check his capillary refill. So I'm just pressing his nail to make sure that it's lasting about 2 seconds, which is very normal. I'm going to have you lay down for me. Okay, I'm going to put the head of the bed down. And here I'm just going to take a look at his trachea, make sure everything looks good, and his carotid artery as well as any JVD. So I'm going to have you turn your head towards your left side. And I'm just looking for any kind of distension in his, for any JVD. I'm going to listen to it for his carotid artery. Everything looks great. All right, moving forward. I'm going to sit him back up, and we'll visit this again when we do his abdomen. I'm also going to have him sit on the side of the bed again so that I can check his thyroid as well as his lymph nodes. So if you can sit on the side of the bed. All right, and I'm going to check his lymph nodes first. First, I'm going to be checking for your preauricular, your postauricular, your occipital, your parotid, tonsillar, submaxillary, submental, anterior cervical, posterior cervical, and subclavicular. And everything is normal. I don't feel any sort of lumps or lymph node edema. Next I'm going to do is have him take a glass of water, and I'm going to have him take a sip of it with me standing behind him. And this is checking for his thyroid. And his thyroid moves when he does take a sip, so that's all within normal limits. I'm going to be looking at his trachea and any sort of deviations, any masses, and everything looks great. All right, so now we're going to go back and check his abdomen, so I'm going to have him sit back again. Make sure he's still in view. For modesty, I'm going to put a blanket over him just so his legs are covered. And we'll lift it down up. All right. So the first thing I'm going to be doing is I'm going to be inspecting. And I'm looking for any kind of visible pulsations or masses. After my inspection, I'm going to auscultate. And there are bowel sounds in all 4 quadrants. I'm going to be doing a percussion. And over his liver, I would be hearing some sort of dull percussion, which would be within normal limits. You can't palpate the spleen. However, if he had any kind of tenderness, I'd be feeling it in the midclavicular line towards the spleen. Next I'm going to be doing is a light palpation versus a deep palpation. The first one I'm going to start is over here with some light palpation. And if you were having any knee pain, I'd be doing the painful area last, as well as deep palpation. Perfect. And for the for exam purposes, I'm not going to be testing his inguinal or his femoral arteries for any sort of abnormalities, but I would be doing that in a regular physical. And while I have him laying down, I am going to take a listen to his heart. And for exam purposes, I'm going to be doing it over his t-shirt. So his aortic, pulmonic, Erb's point, tricuspid, and mitral valve. We've had him sit back up onto the side of the bed. All right, back. Here I'm going to be listening to his heart again as well, now that he's sitting up. And I'll be doing this with the bell and the diaphragm as well. So his aortic, pulmonic, Erb's point, tricuspid, and mitral valve. Perfect. We already checked his capillary refills. Next, I'm going to be moving on to his respiratory. So I'm going to do the tactile fremitus in the front. So say 99.
99. 99.
Okay, I'm going to do that as well as the back. All right, say 99.
99. 99. 99. 99.
Perfect. While I'm back here, I'm going to be taking a listen to him. And checking for any kind of CVA tenderness. So I'm going to be doing, I'm going to listen to him first while inspecting. Take a deep breath in. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Perfect. I'm going to be checking for percussion as well, for any hyperresonance. All within normal limits. I'm going to be checking for symmetry with my hands at the 10th intercostal space for any kind of issues with his lungs. Great, take a nice deep breath. And both are symmetric. I'm going to be testing for some CVA tenderness as well. So let me know if you're having any kind of pain right here. Any sort of pain? Okay. We're going to go back to his foot. All right. The next thing that we're going to do is check his musculoskeletal and if his reflexes are good, as well as his strength. So for cranial nerve 11, can you please shrug up your shoulders and down? Perfect. For range of motion, can you put your head side to side, up and down? Good. Can you take your arms and lift them up above your head? Can you put them behind your back? Perfect. I'm going to test your strength, so you can put your hands in front, squeeze my fingers as hard as you can. I'm going to have you push against my hands, push against my hands, push my hands away, flip them like this. Perfect. Bring your arms straight ahead, push my hands away, push my hands away. I'm also going to be checking his legs the same way for the lower extremity. So he's going to be pushing his legs away from my hand and away from my hand. Perfect. And your knee as well. Push against my hand and against my hand. His strength has been 5 out of 5 for all of them. I'm going to be checking his pulses as well. I want to make sure that they are not bounding or too weak. So I'm going to be checking his radial, which is +2. Brachial. Popliteal. And his, lift your foot up, pedal pulses. And they are all around +2. I'm going to be checking his reflexes. So we'll start from the top. So if I can take your arm, please, and just relax your arm. And his radial for his upper. I'm also going to be doing his popliteal. Just have it raised. And the femoral. As well as the Achilles. And I'm just doing a unilateral right now for the form of this test. The next thing I'm going to be doing is, this whole time I'm also checking his skin, making sure that it's nice and warm, any sort of turgor if he's dehydrated, but everything's been looking really great for him. I also want to go over the rest of his neurological exam, so I'd like for you to tell me where you are.
Advent Health, Orlando.
What day is it?
Friday.
And what is your name?
Jonathan Clayton.
Okay, so short-term and long-term memory have been well. I've been listening to the way that he speaks, so his cranial nerves are all intact. That completes our cranial nerves. I'm going to look at his palms and make sure that he can go really fast on your thighs. Good, so his coordination is fine. If you can put your finger to your nose, follow my finger, and back, and back. Perfect. I'm going to have him go for a walk on the floor, make sure that his coordination is okay. So if you can face me, and please walk normal. And you can back up, and please walk on your toes. Good, and go back. And if you can walk on your heels, and go back. And I want you to do heel to toe. Like so, one foot in front of the other. Yep, perfect. Perfect. Okay, you can stay right there. I'm going to have you bend down for me. And I'm just checking to make sure that everything feels okay in his spine, that there's no deviation or any sort of other masses that I can feel. Perfect. All right. You can come and sit back down for me. All right. And I'd be looking at his feet during this exam as well, and everything looked like they had no swelling, no edema. And that concludes my entire head-to-toe assessment. Thank you.